welcome to today's Fireside Chat, hosted by Interactive Digital Solutions. We're excited to have you here with us on this wonderful presentation about scaling telehealth operations with TSIM, Lessons from Sanford Health. This session is part of our ongoing series where we explore real-world solutions in healthcare communication and collaboration. Today, we're diving into the realities of telehealth growth at scale, the strategies Sanford Health used to succeed with TSIM. A little housekeeping. Feel free to submit your questions at any time through the chat box. We will spend a little time afterwards to address those questions. This session is being recorded, will be available on the IDS website, and will also be emailed to participants after our webinar. I'm Valerie Collinsworth, Chief Marketing Officer at IDS, and I will be your moderator for today. So let's get started. Let's meet some of our speakers. Our host today is Dave Lund. He's the Director of Healthcare Business Development at IDS. And then we have Najib Ben Brahim, Chief Executive Officer and founder of Ignis Health. Joining Dave and Najib are Ryan Narlock, Program Manager, Virtual Care at Sanford Health, Amber Johnson, Customer Success Strategist, Virtual Care at Sanford Health. Together, they'll all walk us through the lessons Sanford Health learned while scaling virtual care operations across their enterprise using TSIM. So here we go, Dave. Take it away.
Oh, thank you, Valerie, and welcome everyone. We're really glad to have you here. At IDS, we do more than just support telehealth. We lead the build out of intelligent ecosystems that make virtual care sustainable. We also bring together the right mix of tools, platforms, people, and partners to help telehealth systems like Sanford's not only launch but scale enterprise-wide enterprise-wide telehealth programs with confidence. And when we talk about scaling, we can't ignore the need for a structured model. That's where the partnership with Sanford Health and Ignis Health shines through. With that, I'll let Najib give us a quick overview of Ignis Health.
Thank you, Dave. It's a pleasure to be here, and thanks for hosting today. Well, I'm the Chief Executive Officer and founder at Ignis Health. We basically partner with healthcare organizations such as Sanford Health to enable them optimize their operations through our software solutions, whether it's telehealth purpose-built analytics or project management tools. And we're very excited to have Ryan and Amber to talk about the challenges, solutions, and their experience as they optimize their operations and scale their telehealth and virtual care programs. We've had a long-standing, multi-year, amazing relationship with IDS, and we're very thankful, hopefully for many, many years. So thanks again for having us today, Dave, and for hosting the webinar.
Yeah, sure, of course. So today we're bringing an impressive real-world experience with Sanford Health, leveraging the TSIM to scale virtual health across the enterprise. So let's dive in. Hi, Ryan. Can you start us off by giving us a brief overview of Sanford Health and how your virtual care program has grown over time?
Yeah, Dave. First off, though, thank you all for having Sanford chat with IDS and Ignis Health. It's a pleasure to be here and talk about our experience and our journey, especially through virtual care, as we've seen virtual care really start to grow over the last few years coming out of the pandemic, or even surviving through the pandemic. But I do want to just tell you a little bit about Sanford and our virtual care offering. So I'm going to share my screen here. So I'm hoping everyone can see it. It looks like you guys should be able to here. And so Sanford Health, our system is primarily located in the Midwest. We cover Iowa, North Dakota, Minnesota, South Dakota, and Wisconsin. And we consist of about 56 medical centers, 288 clinic locations, 147 senior living centers. We do have 4 rural clinics located in Costa Rica, Panama, Ghana, and New Zealand. And our employee base, as you can see, is just a little over 53,000 family members to our system. With that, we have over 2,200 physicians and approximately about 1,800 APPs that help support our services here at Sanford. And with regards to our virtual care department, it really got its start around 2011 is really where it started to pick up for us and become more of a formal department and process a little bit, you could say. And it's continued to evolve through offerings of video visits, e-visits, verbal visits. We have RPM and dabbling into that hospital at home concept as well. And so these types of virtual care offerings can really be seen whether the patient's at home, in the ER, inpatient, with pharmacy services or radiology services, as well as our long-term care settings as well. And on average, per year over the last 3 years, I'm going to say we've probably conducted a little over 13,000 verbal visits and e-visits per year, a little over 70,000 video visits, and nearly 18,000 facility-to-facility video visits. So that's just a little bit about our virtual care and the size of volume that we do conduct here. As you can see on the screen, though, some of those numbers articulate from conception, which is, again, from 2011. But what excites me, I would say, the most lately at Sanford is our virtual care center. So I always have to put a little bit of plug in about our virtual care center here. And thanks to a beyond generous donation by Mr. Denny Sanford in 2021, Sanford launched a landmark virtual care initiative to fundamentally transform how we deliver care to our rural footprint. And so in November of this past year, we opened the 60,000 square foot virtual care center, and with its grand opening. The center itself hosts teams from virtual care, IT, education, innovation, and a few clinical operations teams at this point. But the center is the focus of access to care, care delivery, the Innovation Institute, where we can work with partners to overcome challenges we are facing. The Education Institute as well, where we're looking at how to train the future generation of clinicians, especially in terms of virtual care as we see them, the younger generations coming up and starting to help service our systems. As well as we have a patient experience lab in the facility where we hope in the future to start to bring patients in to interact with the new developed technologies that we're putting in before they actually get into production, just to help understand that patient experience a little bit more before we actually implement some of these newer technologies and services. And so ultimately, though, this facility does help represent our commitment to our patients to provide the right care at the right time, and in the right place as well. That's most important and very meaningful to us here at Sanford. So that's just a little bit about Sanford Health System, and as well as sort of what we have going on with our virtual care center and virtual care offerings as well. So I'll pass it back over to you.
Thanks, Ryan. That was an impressive overview, and we're lucky to be working with you on this. And I wanted to sort of have this as a sort of a chatting format and not like a typical presentation. And I know that before we started working with you, you were already sort of scaling up telehealth and virtual care in general. And you were facing some challenges, so leading up to, that led you to ultimately partner with us. So, and we're also very lucky today that we have both of you and Amber, because of your roles, you have different perspectives. So I wanted to ask this question to both of you. What kind of challenges, if you can go over some of those, what kind of challenges you faced trying to scale up the telehealth operations, and kind of shine some light into, what led to fueling those impressive numbers that you just shared with us today.
Yeah, absolutely. Well, at the time of adopting TSIM, we experienced the least challenge with technology and workflow coordination, just because we've set standards and aligned those workflows from years past, really, with this care delivery model. So we had a good footstep there. Additionally, we have a single EMR for the most part, where it allows us to really anchor the start and stop of virtual care essentially from the EMR for simplicity factors. you know, although as many other organizations, we do face network and broadband challenges, especially with our footprint being rural in the Midwest, right? So we struggle through some of that, but from previous years and really being firm on those standards of technology and workflow, that we didn't experience as much issues just trying to scale that way. But ultimately, though, where we've seen the greatest challenge for us came from visibility. So managing the large program, or our large program, really required us to work across multiple systems to track where services requests were, provider availability, service locations, equipment inventory, and contracts. So this essentially resulted in a really highly manual process for our virtual care team to gather and monitor where we were at with virtual care, and especially coming out of the pandemic. So with TSIM and the implementation of it, it really allowed us to centralize much of that information, providing visibility across the enterprise. And the one main advantage was just the ability to create a Google Maps view style of our virtual care services across the entire footprint. That really gave us insight to where and what services are available and what providers were performing those services, even within our footprint, at a simple glance, right? And so that was huge for us, and a big challenge we just were faced trying to keep up with the growth, especially post-pandemic, of everyone wanting to do virtual care and trying to manage it in an appropriate way. And so TSIM was a great help there, and that was a challenge we faced. TSIM also helped us standardize our implementation process. Previously managing those multiple systems, right, for the virtual care development or service line, we would call it. We now have that one system that takes the request, puts it in the pipeline, and then it also puts us on the path of a standardized and a comprehensive implementation task list. Creating a unified experience, not only for the service line leaders, whether they're from oncology or cardiology or orthopedics, but also for our virtual care team that really took the blunt of that work of just trying to manage all those systems. So that was sort of the challenges I foreseen or seen from my view here at Sanford with the virtual care team. But Amber, I know we got you on here today, and you were a huge part of working with us to implement TSIM and the struggles that we face. So anything you would like to add?
Yeah, as Ryan alluded to, I would say that reporting and visibility was a challenge. One example that I thought of was with our previous project request form. We had several free text fields, and so this created a lot of barriers when we were attempting to pull data. We would maybe have one request that said Sanford Sioux Falls Medical Center, and then we would have another request come in that would say Sanford USD Medical Center. And while this is the same location, the naming convention was not the same, and so that did not allow us to pull our reports efficiently. In TSIM, we now have drop-down selections, so it has the strategic naming, and this has eliminated a lot of that barrier to providing accuracy.
Well, thank you both. Thank you, Amber and Ryan here. We often run into a big misperception that telehealth is just a feature and a click of a button. But we certainly know, based on our experience with customers, that it is far from simple. So Ryan first here. Ryan, can you tell us why that is not the case and shine some light into the complexity of telehealth operations?
Yeah, Dave, you're absolutely correct. It's not as simple as just clicking the video connect button and you're on your way with the service you're providing to your patients as well. Clinicians need to have the right credentials, privileges to provide that virtual care service, such as being licensed in the state where they're physically sitting, but also where that patient is sitting at that time. Not even that it could be where the patient was or typically at with their home address, right? If they're in North Dakota, but yet they're in Florida, in order to see that patient, that provider would need a Florida license as well. And so, that's a challenge. The EMR build is slightly different with regards to billing and coding. Then you layer in the contracts you may have with payers if your health system goes down that route, working with payers. And then additionally for us too, managing schedules and when conducting like a facility to facility type of telemedicine for us, there's 2 schedules that needed to be managed. So it's not as simple as just going into the EMR, clicking the launch button, and you're on your way like you would with an in-clinic visit. You also layer in making sure the patients get checked in accordingly, get joined to the visit as well. And so there is those complexities. Additionally, then you bring in the training too for the specific type of virtual care and the specific technology in that workflow. So at Sanford, we truly have tried to consolidate down our platforms, but we still probably have about 3 systems for video based off of whether they need access to the EMR, do they need a peripheral device, or on the setting they're actually in. And so then you get into what we call as website manners, just like bedside manners too, where you need to educate them to, make sure you're looking at your camera when speaking to your patient, just like we should be. Also, is your background clear? Is there clutter or not, right? Making sure it is presentable and it looks like your healthcare organization in a professional place. And then making sure you don't have staff walking by as well for that factor. And so, we are actually in the process of creating our own virtual care curriculum that contains all this type of information versus the layered in tips and tricks or workflows that we previously had done. And we hope that putting together more of a robust of like what it takes to actually conduct virtual care helps train those clinicians, and especially those who have not adapted and moved over into offering virtual care, because we're definitely starting to hear and listen to our patients and requesting, and if we don't fulfill that need too, right, they may go to another system and change their course of care. And so we definitely think that that's another component really when you look at it not being as simple as what you may be used to, because maybe all you do is practice in the clinic and become so routine. So when you start layering in these other things, really we want to make sure they're all there. And I don't want to scare anyone from, providing virtual care. It is, once you get set up, you get used to using it. It is easy and can be just as conducive and conductive as an in-clinic type of visit as well. So.
Great. Thank you.
Yeah, sorry, go ahead, Dave.
No, please.
Thank you. Well, Ryan, that was a great overview, over how challenging it is and how complex it is in terms of operation, not just a click of a button. And now that we understand the challenges, I would like to shift the focus a little bit on the solution, which you ultimately ended up implementing and utilizing TSIM for the day-to-day operations of virtual care at Sanford. And because Sanford is such a big place, you have tens of thousands of employees, you obviously have, an IT department with a bunch of enterprise resources, software resources available to you. And you also had other off-the-shelf, software solutions that you could have utilized to solve those challenges. So I'm very interested in knowing what led you to, have you tried any of those before implementing TSIM, and what led you to seek out that new approach, in terms of just beyond your typical project management for this, complex operation?
Yeah, you're correct at Sanford, being quite large and having a very robust IT department as well as operations. We definitely tried to use some of those off-the-shelf tools that we have in our system that support other areas, such as Microsoft Excel, Smartsheets, some ServiceNow, just a few to just name off that we've tried to use, and they're great products for the right fitting. But ultimately, what led us to seek a new solution was just the fragmented information that I was sort of talking about earlier and being spread across multiple systems. So having to work in 3-4 systems. And which of none were telehealth focused. And so while we continue to use a few additional systems, probably more specific for functions like contracting or credentialing, TSIM again simplified that with our tracking of virtual care. And so it was a one system that was the solution we were really looking to try to solve, or the issue we're trying to solve. And what set TSIM apart is that it is one of the only platforms that I came across purely built around the process of telehealth. And so for organizations that have yet to establish a mature framework around, the phases through TSIM, like pipeline development, strategic planning, implementation, operations, TSIM would provide that structure and that coordination to help support that evolution to a virtual care program. But for us, it was more software based, and that's what helped actually our program mature beyond where we were at prior to TSIM. So.
Great, thank you. So Amber, I've got a question for you. How does TSIM's structured framework and project management platform support your day-to-day operations now?
Yeah, so our team is comprised of 5 strategists. We do work our projects from start to finish. So this may be a little different than other organizations who have team members who are solely focused on one aspect of a project, like credentialing or training. So TSIM ensures that all of us are using the same process for every implementation that we do. In addition, TSIM also provides us with that flexibility we did need when we are working those projects that may not be typical. We have our standard service line projects, but then we are also sometimes pulled into larger implementations where virtual care may just be one piece of the project. And TSIM really allowed us that flexibility to work both types of projects regardless of our team's involvement. I would also say having the visibility into other strategists' work has been extremely valuable. If I'm working on a similar project that one of my colleagues did historically, I'm able to go in and see their notes and the work that they did. Or if one of us does need to take over a project, we can do so in a seamless manner.
Oh, great. We'll go on a little bit deeper on this question here. So Amber, could you give us a few examples of operational efficiencies or improvements you've seen since TSIM's implementation?
Yeah. Shortly after we went live with TSIM, we did have 2 new strategists that joined our team. Their onboarding timeline was significantly shorter than previous hires that we had, and I do definitely attribute that to having a standardized implementation process, along with they had all of the historic resources and data readily available for them in TSIM, and it was all in one location. I also think having the ability to link providers to projects or sites to providers and so on. We can pull up a provider and we can see everything that is associated with that provider, same with a site. Historically, if we were asked, for example, what specialties do we have in Aberdeen, South Dakota? We could pull that data, but it would be more of a manual process and it could potentially be from multiple locations. So this definitely saves us time. And then it also gives us the confidence that our data is accurate. Looking back, I do wish we would have maybe scrubbed our data to a finer level before we transferred it into TSIM. Now that we know how valuable that linking is, we've spent a little bit of time having to clean up some of our outstanding data, but that would just be my recommendation to other organizations looking at TSIM is to just do that, take that time and do that thorough scrubbing of their data before transferring in.
Thank you.
Thank you, Amber. Oh, thanks, Dave. So now I would like to cover more the implementation side, right? So based on our experience over the past 10 years, I personally believe that a cross-organizational approach is best when it comes to large healthcare organizations properly executing on their virtual care services and vision for those services. And I also understand that implementing a software, whether it's TSIM or not, is not just a click of a button and all of a sudden everything is streamlined and good to go. And a system like TSIM touches multiple aspects of a multidisciplinary team when it comes to taking projects or service lines from that inquiry phase all the way to actually seeing the first patient live and beyond. TSIM specifically kind of requires a component of change management for the team, for to make sure there is a wide adoption. So I wanted to ask you, Ryan, as sort of your role, oversight role for the virtual care team, if you can walk us through in as much detail as you can the internal challenges and changes that had to happen within the Sanford virtual care team for a successful implementation of the TSIM software.
Yeah, let's think about that one here. Since our virtual care implementation process was sort of well established prior to TSIM, the impact, I would say, on the operational stakeholders requesting the services were relatively minimal because we sort of groomed them, leading up to our implementation. So the main adjustment for that group in change management was just the introduction to a new standardized service request form, which fed into our implementation timeline. Or pipeline, sorry. And then, for them, additionally, it was, becoming accustomed to more of the structured standard task list and what the expectations were. So there was a little bit of that, but it seemed like because we've been trying to push this in the standard process, even prior to becoming more mature in that task list space, I felt like it was less challenge from them or challenging us back on why or what we're having them do in that process. I felt like more of the significant change really occurred with the virtual care customer success strategists such as Amber and the team. They transitioned more to an implementation process, including having to set clear target completion dates, having to ensure that they're actually making sure the project progresses through all those phases accordingly, like I talked about a little bit earlier. And so that shift brought greater consistency and accountability to the implementation process, but it did take some of the time and adjusting, I guess I would say, even to the time commitment to really actually become more mature, more standard and detailed in those tasks. But I think at the end of the day, when I look at it, it's definitely a way more transparent implementation experience, not only for those requesting the services, but also for a strategist. So it was a lot of more explaining why are we doing this and what's the benefit, right? And that's still, I feel like initially, is maybe questioned, but as we've watched Amber and team really evolve with the system and becoming more formal with the process of implementation, it's made a big difference for us, I would say. But that was probably the bigger challenge, is just those directly working with the system, and then relaying on what the expectations were up front and making sure it's just that standard process. So that was probably the bigger change management, is just working within our own smaller virtual care team of the change.
Great. So Amber got another question. So knowing that virtual care requires coordination across multiple departments, and each department then is already using their own software tool, how has TSIM helped you coordinate across multidisciplinary departments like clinical, IT, operations, compliance, etc.?
Yeah, currently only our strategists are working in TSIM. However, with our standardized process, it ensures that we are not missing any requirements that is needed from another department. So for instance, if we're running through our project and we know they need equipment, then we need to make sure that we're connecting with IT to make sure that gets done. Or if a contract is needed with legal. So it's just making sure that we are not missing anything that is needed outside of our department. But then on top of that, each department is also very aware of what their requirements and their responsibilities are when it comes to virtual care. So that definitely helps keep everything cohesive and ensures that we have a successful go live because everybody, is on the same page.
Okay, great. Thank you.
Thank you, Amber. So kind of diving a bit deeper on the complexity, Ryan, I know that with more complexity comes a more pressing need for oversight and transparency across the team and organization ultimately. If you can share with us some of the impact that TSIM had in terms of oversight and transparency. And also, I love data, so I wanted to ask you this because you can get so much data about your operations from TSIM. So I wanted to know, how did you leverage such data for, the Sanford virtual care team?
So you're asking us, how did we solve what would it be, the fire drill type of get me the data at the last minute issues that always seem to present. It's very common for our leadership to really ask where virtual care implementations are in the process, how many service lines have we completed, or how many are in the queue, or et cetera, who's providing it. Like that's what we call the fire drill, Friday fire drill here at Sanford, sometimes just trying to gather that information and going back to really the challenge of having that oversight with all those systems prior to TSIM really created more work. But TSIM allows Amber and I to quickly now gather that information and report it up, whether it's for a team huddle or a meeting or a manager or a director, or even especially with our virtual care initiative, right? A lot of executive level report outs as well. So just being able to grab some of that base information and the overview, really showing how our virtual care program is developing over the last 3 months, 6 months, 9 months, or a year, right? Just being able to articulate that and feel confident in it has really provided us the better transparency of really where we are with virtual care, because at Sanford we do have a lot of eyes on it, going back to our initiative and the generous funding as well that we have. We want to make sure we're doing right for our patients to really grow. So we want to make sure we're able to consistently report that type of data up to our leadership to be proud of, really.
Oh, great question. So here's an Amber and a Ryan question here. So whoever wants to go first, are there any specific features within the TSIM that have had the most impact in your opinion?
Amber, if you don't mind, maybe I'll go first. I got 2 features within TSIM that really come to mind for me. First, again, it sort of links back to what we just talked about, the ability to quickly access data. And I think of like that map view of the sites, the providers, the specialties. They've been extremely valuable and given us oversight and being able to lift that up. And it's that quick, clear at a glance for me understanding of the services we have at the footprint and where maybe we can leverage them throughout our system. And actually being so proud of that visual, because we've never had it before. We actually put it on, we call it an activity on our large interactive TV wall in the entrance of our virtual care center. So it's like 16 by 9 feet or something. So it's big. So it's really enjoyable to actually just pull up this Google style map and actually look at like how much virtual care is being delivered across Sanford. It's just amazing to get to see. And as Amber and team really continue to work all those requests, right, we just see that map growing and growing, and it helps provide us that insight. And what's fun is, other staff coming into the building, whether it's for meetings, or colleagues, or even community members who may pass through, right? That's an activity that they get to just really understand, what are we trying to do with virtual care, and understand how actually much we've grown the program here at Sanford over the last, 5-10 years, I would say even. And so sort of weighing into that is just that analytics capability. It's a powerful tool, and it helps us with workload management. We know, how many service requests are in process, how many strategists are actually working them, right? And so it just really gives us that overview and understanding that we just didn't have as much previously. And these analytics really demonstrate the virtual care growth, which essentially helps weigh into our strategic planning for the future. And so those, to me, were a couple that came to mind. But Amber, any that, really stay at the top of mind for you?
Yeah, I mean, I would concur with Ryan, and I know we kind of keep hammering this home, but, with the analytics, and just being able to not only see the data or pull it quickly, but even just that historical trends. For instance, we recently noticed there was a lower number of projects in our queue than we typically have. And I was able to go back and see over the past 2 to 3 years, this time of year, we normally have fewer requests come in, and then it tends to pick up as the spring progresses. And lo and behold, that's exactly what happened. So we could see those trends and know that this is normal for us. There's not anything strange going on. So for me, I feel like that's so helpful and valuable, as Ryan said, even just knowing how to plan for the future, or even 6 months down the road, or however far out we want to look. The other piece that I think is really impactful is being able to link our equipment that we have to clinical sites. We know not only what equipment is at each site, but then there's also the specifics that go into that equipment. So it could be the serial number, the site's accounting information, or even the date that the equipment was received. Before we had that information, but it was maybe in multiple locations, which then of course increased the risk of it being incorrect or potentially having missing information. So for me, I would say those are the two biggest impacts that we've noticed.
Thank you, Amber. So I want to take this opportunity that we have, with us, people who have some real world experience, not just theoretically talking about telehealth and virtual care. So Ryan, I wanted to, pick your brain about looking into the future of telehealth and what that means, especially with today, we have an abundance of data around telehealth, which is sort of new to the whole industry. We also have an incredible amount of innovative tools that are coming out, whether they're based out of on artificial intelligence or not. So I wanted to kind of get your opinion and thoughts on overall the future of virtual care.
Yeah, I always joke, I wish I got paid every time I heard AI. I probably could retire, but no, you're correct. But most importantly, listen to your patients and your clinicians, or at least us listening to our patients and clinicians. Virtual care will definitely have its place in healthcare moving forward, right? There's no question about that, but there always will be a place for that in-person visit, the surgeries, and everything else that goes on with our brick and mortar. But virtual care essentially will allow us to gain efficiencies, whether it's possible, and improve the patient experience, and even potentially solve some of the issues we have with access to care. Regarding the AI and data, I always think of it, it's not a question of will, but essentially when organizations will adapt AI, leverage the data that lives in the EMR, or even adapt any other innovative solution, right? The time is now. And so from the surface, I would say these types of tools appear to be able to make significant impacts to the systems in terms of clinical outcomes. Importantly, right, the patient experience, and even, I guess, even more important too, is the workforce challenges many face, right? We got to have the people to be able to continue to essentially continue offering the services, and especially in rural facilities, and keeping them open, right? But I guess when I think of it, AI and so forth, first and foremost, organizations need to truly identify the problems they're trying to solve versus just implementing AI because it's the most talked about technology in healthcare right now. At Sanford, we do have an AI governance committee that looks at all the requests and make sure that we are heading in the right direction with the usage of AI. There's just not as much structure out there, and you're starting to hear conversations from a federal level, state level, like how do we really wrap our head around AI? And so I think there's a lot more that needs to go into that, and just not simply putting it there because we think it could solve something, right? Make sure you identify what you're trying to solve, and then say, is AI the solution, or is there another solution that maybe could help solve that problem? I feel like healthcare tends to be a little bit behind on the innovative technology adoption versus some of the other business lines that we may see. But I think organizations are now really starting to see the difference and essentially the need to adapt solutions such as virtual care. And so, again, part of our virtual care center opened just, last November, as I mentioned, is, looking at the Innovation Institute, where we're really looking to bring in partners to help solve some of these challenges, or whether it be AI or other, right? Or even allow spaces for our colleagues to come in to a work environment with their inventions that they're looking at, and trying to give them that space and the technology to support them to continue to develop their invention, or even help them through the patent process as well. Additionally, I think another big area of innovation that we're starting to look at too is just the VR simulation, and understanding, is this more innovative of how we could potentially train future clinicians in specific areas, or is what we have sort of better than VR simulation? So that, that's another innovative area that, you're starting to hear talk about in the healthcare industry. So I think those are a couple areas, or at least my thoughts even on AI and innovation overall.
Okay, great. Well, kind of in the spirit of wrapping up here, we've got a couple more minutes. We've got some great questions here from the audience. A couple have been answered, but there's one open question here. It says, being a multi-state provider, does TSIM have the capabilities of tracking provider licensure for each state? So Najib, do you want to address that one?
Yes, so the short answer is yes. As Amber sort of mentioned, the system would not be a replacement for the already existing licensing software, but it's for the virtual care core team to keep track of those licenses. Otherwise, you have to log into a different system, or keep track of it in Excel spreadsheets. And we know, we all love Excel spreadsheets when they have 2 items, but if you have 2,000 items, good luck with that. So yes, we do have a feature so you can keep track of those different multi-state licensing situations.
Okay, great. So let's just, I've got one question here. It was also anonymous here. We'll let that be the last question unless there's some more from the audience that you want to post. So how flexible is TSIM in supporting Sanford's virtual care program? So Amber or Ryan, either one.
Yeah, I can start out. How flexible is TSIM? Our experience with TSIM has been highly positive. One of the most valuable aspects of actually working with them is just their willingness to adapt, innovate based off of our feedback. And so if we have, let's say, a standard workflow that just doesn't align with or they do with that just doesn't align with our needs, they're open to exploring those adjustments as a collaborative team, right? It doesn't feel like it's you or I in this. It's a team-based approach. And so when I look at TSIM and the experience that we've had, it's not just the platform itself, it's their actual understanding of the telehealth dynamics that really made the experience meaningful to us, at least from my perspective. But Amber, please weigh in, as I know you've worked maybe even closer with them than I have, which we together have worked quite a bit.
Yeah, no, I would absolutely agree with Ryan. Our TSIM team has been incredible. We're kind of a squeaky wheel. I feel like sometimes, we're often bringing things to them, an idea, a suggestion. Sometimes they have a solution that's readily available that maybe we didn't realize that we could use. Or there's oftentimes we're brainstorming together of, okay, how can we make that work? Or how can we fit that into TSIM? And they definitely recognize, what Sanford needs or is looking for may be different than another organization. And they definitely have embraced that, which has just been tremendous, and I honestly cannot say enough good things about them. They are extremely flexible and willing to work with us. And like I said, even if it's not something that exists, they're more than willing to look into it to see if there's a way that it could come into fruition. So very pleased with their flexibility.
And Amber, just to piggyback just a little bit further onto something you said, just, their willingness to accommodate, but also like you're talking about a little bit is just their ability to bring in other organizations' experience or maybe a workflow, recommendation to what they've seen elsewhere in the industry. Because, and that's the beauty of it, right? Because we know at Sanford we don't have all the answers, but as a collaborative team between us and other colleagues throughout the country, right, we can solve some of these issues. And so just having that feedback of like, have you guys thought of this or thought of that, right? I think that's been another flexibility component, just an experience of working with a system that is truly just focused on telehealth, right? And versus, there may be a specialty of software in a certain area that just you can use for telehealth, but this one really is there, and you have the community, I'm going to call it, to really help bounce feedback off of or understand what others are doing. So
Great. Well, thank you, Amber, Ryan, and of course, Najib, for sharing your insights today. They've been wonderful. For those of you attending this seminar, if you would like to learn more about TSIM and Ignis Health or how IDS helps organizations with telehealth, please reach out to us. We will also be sending you a recording link afterwards. I'm not sure what the timing is on that, half a day or what have you, but it's coming. So on behalf of IDS and everyone here, we thank you for joining us, and we look forward to continuing the conversation. Thank you.